My name is Courtney Davis, and I am the Executive Director of Marijuana Matters. The policy gap between states and the federal government affect progress in the cannabis industry because, as most of us know, more than half of the states in America have some sort of licensed cannabis industry. Yet, the signals that the industry is receiving from Congress and the White House is that cannabis is still a drug, a Schedule I drug that by definition means that there are no known and approved medical benefits. We all know that this is in fact incorrect. We should be able to lean on the federal government to apply pressure on states to create equity within their licensed cannabis programs. There are several examples of this where federal agencies will create a grant program that states may apply for if they are hitting certain benchmarks. We could codify into law that states that create automatic expungement for cannabis-related charges are eligible for this funding to pay for the training and education that goes into implementing a new law from a systems level. The state could also use the money to support the judicial staff or update their technology that's necessary to expunge records and also to do outreach to the individuals that will benefit from this law. We should also urge states to focus on leveraging data to make sure that the outcomes of their equity measures are being met. Creating a national strategy on social equity in the cannabis industry, coupled with funding for education and resource building, is a type of leadership that we need from our federal government. Instead, we have a patchwork of state laws that are creating challenges surrounding financial services for marijuana businesses, federal tax issues for these businesses, including social equity applicants, which is the very population of individuals that we are working to support and uplift in this industry. There is now a record high of 68% of Americans that support legalization, so it's not a conversation of if, but when. Organizations like Marijuana Matters, Women Grow, Hood Incubator, and Cannabis Nurses of Color exist to ensure that when legalization occurs, it includes policies that can reverse and repair the most egregious effects of the war on drugs on communities of color. Public institutions, communities, and cannabis business owners all have a responsibility to create an industry that does no more harm. And in my opinion, the federal government, which banned cannabis nationwide in 1937, which then led to increased punishment for cannabis, mass incarcerations at the state and federal level, does not get to sit this one out.